Hello and everybody and welcome. We're going to give about another minute or so here before we get started. See, our participants keep popping up, so I'm going to just, at some point here, we'll just get started. Okay, let's go. Welcome everybody to our series. Let me share this presentation. And there we go. Welcome to Michigan HIMSS Webinar Series 2021. Today we've got a great presentation called Track It All. Learn how to secure your assets and route your people effectively using a single command center. The Michigan HIMSS chapter is pleased to be hosting this seminar. We're trying to do these about a couple times a month, so keep track of us and follow our webinars. We're doing a lot of these in lieu of our presentations that we've done in the past, our on-site presentations, and hopefully we'll get back to those pretty soon. My name is Jerry Morin. I'm the past president of the Michigan HIMSS chapter, and I'll be moderating the webinar for us. Slide. You tell me this is going to happen, Lee. There we go. So thank you. I'd like to thank our sponsors that sponsor our Michigan HIMSS chapter. As you know, we're an all-volunteer organization, and the only revenue we get is through the sponsorship that we get from our sponsors. So Connection is our premier sponsor. Blue Cross Blue Shield is an executive sponsor, MyHIN, and Spectrum Enterprise. So thank you again to our sponsors. A little housekeeping here. The webinar is being recorded, but all participants are on mute. So we're going to take questions at the end. And so if you've got questions, as your questions arise, if you put those into the Q&A section for us, and then we'll present the questions to the speakers at the end. So as an introduction, we have two speakers today. Brie Riley is project manager of the Henry Ford Systems Innovation Institute. She's responsible for creating, managing corporate partnerships, accelerators, incubators, venture capital firms, hospitals, device manufacturers worldwide to source technology for commercialization. It's pretty interesting. She's going to give you a little more about the Henry Ford Institute, but there's a lot of good things that come out of there. She vets and builds license deals for early stage business opportunities for co-development projects focusing on digital health and medical devices. She supports Henry Ford Systems' global program by examining new market opportunities and providing financial analysis. Prior to coming to Henry Ford, Brie consults for companies around the world on strategy, business operations, and marketing. And clients included technology startups, economic development organizations, healthcare companies. She obtained her business degree, graduating with high distinction from the University of Michigan with the Stephen M. Ross School of Business. Our next speaker is Paul Singh. Paul Singh is the Apple practice lead at Connection.
Hey, Jerry, this is Lee. I'm sorry for interrupting.
Mm-hmm. Okay.
Could you share your screen, please? I don't think we can see the presentation. Thank you.
Okay. I thought I did. How are we doing now? Can you see it now, Lee? I'll take that.
Yeah, we can see it now, Jerry.
Okay. Yeah, we can, as long as you can put it in a presentation mode. Thank you.
I did that. All the practice in the world doesn't help, does it? Here. Okay, how's that?
There you
Looks
go.
good.
Perfect.
All right.
We know
So,
Jerry has 4 screens, so.
yeah, it's kind of a challenge. So I'm going to just back up and give you a little visual of Brie, but you'll see her here as we go through the rest of the webinar. Back to Paul. He leads the Apple practice at Connection Enterprise Solutions, and he's responsible for the Apple partnership, strategic vision, and the Apple mobility partners. He supports Connection customers as it relates to Apple hardware, software, professional services, and develops complete end-to-end solutions that include mobility, referral partners, technical support, Apple hardware that solves specific needs for enterprise customers. Prior to joining Connection, Paul worked directly for Apple to deliver solutions at scale that leverage from the iOS, macOS platforms for over 4 years. He's a veteran of the telecom industry and has worked with Apple products for over 20 years. And that's Paul. So I'm going to turn it over to Brie now. Brie, again, project manager for the Henry Ford Innovation Institute.
Great. Thank you so much, Jerry. And thank you everyone today for having me and for joining. Thank you to our sponsors for making this event possible. It's my delight to be here and to share a bit with you today about tracking it all. Next slide, please. Oh, can you go back one slide? Thank you. 20 minutes. According to a study conducted by Pittsburgh Healthcare System, personnel were spending an average of 20 minutes per shift looking for medical equipment. 42%. This is the average estimated utilization rate for mobile assets in a hospital setting. Imagine wheelchairs, IV pumps, and so on. $1.5 million annually. For a 300-bed hospital, it is estimated that approximately $1.5 million worth of medical equipment goes missing each year. In short, there's a lack of data on people and processes, especially the interaction between different areas. This can lead to lower quality services and decreased patient satisfaction, negatively impacting both providers and patients and the entire care delivery team. Next slide, please. Today, I'll provide some background on Henry Ford Health System, our innovative history. Then we're going to take a deeper look at this problem that Nav Systems has identified. We'll talk about the creation of this technology and its launch. We'll talk about the various use cases, and then we'll finish up by talking about the impact to date. Next slide, please. So the Henry Ford Health System was founded over 100 years ago by Henry Ford himself, with the goal of providing really high quality, really safe care. We like to say that because Henry Ford himself founded it, is that innovation is in our DNA. Since 1908, we have grown and expanded rapidly. We now have 6 hospitals across Southeast Michigan, with the headquarters being in Detroit, but we've got hospitals in an urban setting, in a rural setting, and everywhere in between. At our 6 hospitals, we have over 2,500 beds, covering 6 million square feet. We also have over 100 ambulatory care sites. We're a fully integrated health system with a wholly owned payer called the Health Alliance Plan, or HAP, and we generate about $6 billion in revenue each year. Next slide, please. A decade ago, we wanted to further our commitment to innovation, and hence Henry Ford Innovations was born. We were founded as a technology transfer office initially, so taking the really great research, ideas, discoveries, data internally, and putting it into the marketplace. But in our 10 years, we have grown and evolved rapidly. We still have our technology management silo, but our second silo is our corporate innovation component. This involves bringing really great startups, early stage ideas and technologies that can come from startups or large medical device companies, data companies, and so forth, bringing that in, co-developing it, and then putting it out back into the marketplace by leveraging the intellectual property produced by our Henry Ford subject matter expertise. Our third silo is our global innovation component. Henry Ford Health System is an international brand. We have licensed our know-how, including policies, procedures, protocols, workflows, to greenfield hospitals across India and the Middle East. The last silo is really where our story begins today around tracking it all, our research and education silo. On the research side, we have a large 3D printing program focusing on a number of health areas, everything from orthopedics to structural heart, to facial reconstructive surgeries, and the list goes on, all for pre-surgical planning. On the education side, we have a program called the Davidson Fellowship, which is where our story begins. Next slide, please. The Davidson Fellowship is a 10-month education program that caters to entrepreneurs and people who are interested in innovation within the Henry Ford Health System. Each year, we select 25 to 30 participants to go through our course. It's a course that meets 1 hour per month, and it really covers the fundamentals of IP and entrepreneurship. So that's problem identification, through creating that solution, through understanding how to develop that solution from a technological, a regulatory, a legal, and a financing perspective. At the end of the class, the participants will have an opportunity to present what their findings have been. But as they're learning these concepts, we've also made this an action-based learning course. The 25 to 30 fellows at the beginning of the course are divided up into teams based on common problems that they've identified. This is the point where Dr. Dan Siegel, who's our Vice Chair of Radiology and Computer Scientist by trade, met Paul Singh, who is our IT Program Manager. They came together to talk about this common problem of where are our people and where are our things. They worked together over the course of these 10 months to talk about and flesh out this problem that they've identified, creating a technology solution concept that was pitched at the end. Now, in this pitch competition that I mentioned earlier, the winning team has the opportunity to incubate their idea through Henry Ford Innovations. And as a spoiler alert, Dr. Siegel and Paul won in 2015. So let's take a deeper look at our problem statement. Next slide, please. So there's a number of moving components. So what is the main problem? We can't find our objects or our people. So objects could be medical equipment, such as pumps and wheelchairs, as I mentioned earlier, or our people. Where are the transporters? Where are the providers, such as doctors and nurses? Where are the environmental services team? Where is the pharmacy team as they make their deliveries? We don't know where people or objects are at any given time. And consequently, this makes it impossible to estimate the time needed to complete jobs and orders. We don't know how long it takes to clean a patient room. We don't know how long it takes to get from the emergency room to radiology so I can get a CT scan. Really, at the end of the day, this makes us reactive rather than proactive as it relates to operating a hospital. Consequently, we also face high no-show rates. If my transporter doesn't understand the best route to get from the emergency room to radiology, I'm going to miss that appointment for my CT scan. And that's not okay. That's going to lead to frustrated patients, transporters, and providers, overall decreasing patient satisfaction. From an operational perspective, we decrease efficiency, utilization, and wasted resources. So motivated by the inability to locate and identify where people were and where things were, what they were doing, and how long these tasks were taking, Dr. Siegel and Paul came together to solve this problem once and for all. Next slide, please. So Nav Systems is the main company that oversees this technology. They've created something called the Nav Track Platform, which is accessible either on a mobile phone or via an app on a desktop computer. This platform uses indoor positioning system technology to provide traffic control for hospital workflows. It requires no new infrastructure, and it can be enabled in a short time. There are really 4 main components that this technology contains, and I'll walk you through each of them now. The first is our communication platform. Within the app and the desktop setting, employees can communicate directly with one another about the tasks that need to be done. There's also the opportunity for broadcast messaging. What these opportunities enable is for mass communications or individual communications to be done in real time. It's great for large announcements, assigning tasks, and it promotes employee safety at the end of the day. It also reduces call volume and eliminates the needs for pagers in the long run. The second component is capturing and analyzing data. There is a plethora of rich data that can be accessed by understanding where our people and things are, and really understanding that together in one setting when they're layered on the same map. You can monitor workflows so users can reliably understand real-time location, and it also simplifies maintaining a large fleet of mobile devices, meaning that you can look at every user at once. So if I'm overseeing our environmental team, I can see where each individual employee is in the hospital. There's also, of course, the struggle around indoor location and wayfinding. This project got started at Henry Ford Hospital, which is a 100-year-old plus building that's been added upon many times. There are 17 floors, 3 million square feet alone, covering 877 beds at one hospital. As someone who's worked here for a year and a half, it's easy to get lost, and it can be difficult to understand the best route to get from point A to point B. But really what this technology has done is that it creates a wayfinding opportunity. It can help me navigate what is the best route, the most efficient route, and the safest route, taking into consideration even the little things like which doors require badge access and which doors do not. It provides an easy view of the routes, and it can even provide me an estimated time of arrival, which is really important when we're looking at patient satisfaction. The last component is the minimal hardware needed. So Nav systems and the Nav Track technology have created something that works with your existing Wi-Fi infrastructure. It's nothing new it needs to be built on. And the beacons that are placed throughout the building are minimalistic because your phone can serve as a beacon and you're able to tag devices and your badge even as needed. There's not a large hardware requirement needed for this to work well. Next slide, please. So let's look at this and see how this actually operates. So the blue dot, as you can see, that might look a little bit familiar, is that what came out of our partnership with Apple. You can see the blue dot is navigating. That could represent a person or an object navigating through what is Henry Ford Hospital. You can see that each room is labeled. This is our basement that you're currently looking at. So you can know exactly where someone is at any time. The green line shows where that person has been. So you can understand the full route that they've taken and perhaps some of the tasks that they've completed along the way. This map is so accurate that you can look at it down within just a few feet. You can understand where someone actually is within a location. This mapping opportunity also allows you to look at your employees by floor, by job role, and so on. From a managerial perspective, you can also understand the battery life of each of these, quote, mobile beacons, or you can also understand who has which phone at any given time. On the lower left-hand side, you probably will notice that messaging button that I talked about earlier, meaning that it's very easy to access the communication platform that is built within the Nav Track platform. It's also important to consider that in most cases, Nav Track just runs in the background and it pings the location data back to the server. You don't need to have this phone open the entire time, this app open the entire time when you're on your shift. Nav Systems also takes privacy and security very seriously. This app only works in designated areas and only on employer-mapped facilities. So for instance, if I'm a transporter and I go home, you cannot see where my location is as soon as I step off of Henry Ford Hospital's property. Geofences can also be set within the hospital to really limit and restrict tracking. It's also, the last point I would like to make is that this is floor accurate. So across 17 floors in a very old building, I can see right where I am. Even if the walls are lined with lead, I can still get an accurate location that's updated at least once per second. Next slide, please. So what was the roadmap to get from the beginning of this problem identification through where we are today? As I mentioned before, this started back in 2015 with the Davidson Fellowship pitch. Dr. Siegel and Paul won, and they began to incubate through Henry Ford Innovations. But there was a vital partnership that was formed at the same time. In 2015, Nav Systems partnered with Apple, and this gave them access to indoor mapping data format technology, or IMDF technology, as it's better known as. In 2016, after this partnership was formed, it was time to take this technology partnered with Apple and really prove this concept. Could we really prove indoor positioning, tracking, routing, and mapping? And yes, they were indeed successful. In 2017, after validating this high-level concept, it was time to build out a development team and to start bringing this technology to life. The team also coordinated with Henry Ford's IT team to ensure that the integration of the technology was feasible and that it wouldn't inhibit workflow. In fact, that it would rather add value than be one more app that interferes with your day-to-day workflow. We also made sure that the technology could integrate securely with our day-to-day operations and pre-existing technologies. In 2018, the technology was built, and it was time to test it out in the patient transport setting, and it created incredible results. But it also got the team asking, what if? What if it could be expanded to other use cases? And here we are now in 2019, where we see a new expansion of this technology. In this time, they're expanding across use cases. So now it's not just patient transport. We're looking at environmental services, and we're looking at central pharmacy. It's the same technology, just different people tracking different objects. This was also a significant year for Nav from a business perspective, because this is the year that they executed the business deal with Henry Ford Innovations that allowed them to spin out of the health system, and their new company was born. In 2020, although it's been a challenging year for many, Nav Systems has continued to thrive. Now, before we were just at Henry Ford Hospital, but they've been able to scale. This time, not necessarily by use case, but by volume. So now instead of covering 3 million square feet at Henry Ford Hospital, they're covering all 6 hospitals and all 6 million square feet. The team also formed their first partnership with a non-Henry Ford associate. Next slide, please. So let's take a deeper look at some of these use cases. The first one I talked about was transport. Essentially, what this technology that this indoor location provides is you can record arrivals, departures, and it creates a sense of accountability, making sure that that patient gets from point A to point B in the safest and most efficient manner possible. The messaging app also allows the facilitation of sending a second transporter. If additional support is needed, you can ping someone who is nearby to get extra support on transporting that patient. It reduces wait time. I mentioned earlier that you understand your estimated time of arrival, and this technology all comes together to understand how can we get the patient where they need to be, and there are no more surprises. Again, as I've been mentioning throughout, there are safety considerations, and the communication also creates a written record and reduces overall call volume. So we're improving safety and we're improving operational efficiency. The next component to look at is environmental services. Environmental services is interesting because you can really look at a large fleet of phones, and based off of that, you can do proximity-based assignments. So understanding if I'm in room 201 and room 203 right next door needs to be cleaned, you can ping the person who's cleaning room 201 and make sure they get next door and make sure that room is cleaned in a timely fashion before the patient arrives. It also allows them to respond to crises as needed. You can understand where everyone is at any given time, and you can relate that to the crisis in order to create an effective intervention. All that to say is that safety and communication is once again enhanced with the end goal of hopefully eliminating using house phones and eventually pagers. The third component is looking at supply chain. So what Nav Track can do is that it can ensure that the right supplies arrive at the right location at the right time. This is especially important in the time of COVID, where the supply levels were unpredictable at times. So understanding that the gown can get from the delivery truck to, as soon as it gets off, to the frontline worker, we can see that whole process. Again, those recordings of the arrivals, departures, and accountability are all tracked. It really, at the end of the day, it produces a closed loop workflow and a chain of custody. It allows us to streamline our workflow and increase capacity so we can make more deliveries in a more effective way. The last use case is looking at central pharmacy. This will allow us that the right meds arrive at the right location at the right time, really improving the quality of patient care. Patients can be reassured that they're receiving the right medication, and there is no medical waste if used effectively. So again, it's really creating that closed loop workflow and chain of custody. And like environmental services, you're sharing and managing a large fleet of phones. There's a large hospital and a lot of deliveries that need to be made, all within a very short period of time. Next slide, please. So there are so many use cases, so many moving parts, but yet it's a very simplistic setup and deployment. It takes weeks, not months. And it can really be broken down into a 3-step process. The first is to create a digital twin. So you're converting those CAD drawings, either digital or paper, to an IMDF, in this case, because we're working with Apple. And really this great technology that we're working with, the quality and accuracy is currently being used for indoor location projects in engineering and in architecture settings. This only takes a couple of weeks and is a relatively simplistic process. The second component is to create that wireless fingerprint. which this is what enables us to create a really accurate geolocation within a couple meters that's updated at least once per second. And this is done by reading unique wireless signals throughout the building. Actually, it's interesting, the team will do this by walking across all 6 million square feet with their iPhone in hand to make sure that every square foot is captured. The third and final step is deploying the Nav Track app, of course. This can be done via a cloud-based environment because there's such a minimal infrastructure on site that's required, although it can be done on site if needed. In the case of partnering with Apple, this can be done via AirWatch or any other enterprise mobile device management technology. At this time, right now, NavTrack only works on iOS devices, but there are plans to expand this to Android in the future. And really, at the end of the day, their app-centric approach leverages smartphones to greatly decrease costs and infrastructure needed for indoor location, asset tracking, and real-time location services. The number of users can be scaled quickly and at minimal cost because we're using technologies we already have. We're already using those smartphones that employees are using day to day. The smartphones also can serve, as I mentioned before, as a mobile sensor. The accuracy of this network will increase as more and more users adopt the technology. Next slide, please. So really, when we look at our differentiating components, it can be broken down into speed, scale, and savings. So from a speed perspective, the technology can be implemented and deployed quickly. NavTrack was built off of renowned and proven technologies, whether it's Apple's indoor positioning technology and IMDF, or whether it's even getting feedback from Henry Ford expertise, such as clinical experts and IT experts, to understand how can we marry Apple's location technology with a hospital setting. The second component is scale. NavTrack can scale with your needs. So this is scaling, as I mentioned before, scaling across functionality. So that could be looking at pharmacy, supply chain, really the list goes on. But there's also the scalability of volume, of getting more and more users to adopt this very easily. Lastly, there's a savings component. Again, there's little to no infrastructure. So it uses your existing Wi-Fi. The Wi-Fi is augmented with your Bluetooth badges and your tags and your phone. And people and equipment are on the same platform. You don't need different vendors for equipment, for different types of employees. It's all in one centralized command center. It's a platform, not a point solution. Really, the software-heavy model can operationalize costs, easily scale without expensive hardware, and it's expandable. Next slide, please. So I'd like to leave you guys with one last quote. This is from a support operations leader outside of Henry Ford. The NavTrack system significantly helps us improve efficiencies in transporting patients now by pinpointing the exact location of our transporters and patient escorts. And it changes the game for any potential improvement in patient safety and ultimately patient care by knowing where a colleague is so they can get to a patient faster. The future is wide open for tracking assets and notifying colleagues of exact location of basically anything we need to locate. And with that, next slide, please. Thank you guys so much for your time, and I will pass it off to Paul to give a technical oversight.
Just before you start, Paul, I just want to say if you've got questions, start entering the questions in now. When Paul's finished with his short presentation, we'll be taking questions and answering them. Thanks, Paul. You're on mute, Paul.
Wow, that's not great. Well, first off, thank you, Jerry. Thank you, Brie. Great presentation. I'm going to briefly cover who's Connection, what Connection does in the healthcare space, and our Apple practice here at Connection, and then how we bring it all together on a solution like NavTrack. It's more than you think. It's definitely somewhere you want to look for a partner to help you deliver at scale. So next slide, Jerry. So who is Connection? Connection is a global IT solutions provider that is broken into 4 different segments. The Business Solutions Group is a small business segment. the Enterprise Solutions Group, which Jerry and I are both part of, the Public Sector Solution, which covers our public sector and higher education, and our Global Procurement Solution. We cover 4 verticals: healthcare, retail, finance, and manufacturing. And to support all of these divisions, we have professional IT solutions and services that are very specific and help you deliver solutions at scale. Next slide. The Apple practice at Connection. We're talking about Nav Track today and Apple's indoor positioning and mapping solutions and how that integrates with Nav Track. Well, when you're delivering a solution on iOS and specifically with an application partner, experience matters. It really comes into play when looking at delivering iOS at scale. And Connection's been an Apple partner for over 32 years. We go back to selling Mac computers through a catalog, for example. We're one of 5 corporate approved resellers for Apple. We hold that distinguishing factor. We're Apple authorized service provider, and we're actually one of 3 approved in the higher education space. So we have experience, as I mentioned earlier, about integrating iOS into Apple. We currently have just deployed the largest iPad deployment in Apple's history. We also hold the 2nd largest iOS for iPhone deployed in the marketplace today. We have a dedicated team that came from Apple. And I'm not mentioning this for sales. I'm mentioning this so you can feel comfortable when looking at a solution to deliver it at scale. Professional services, we can deliver Apple's authorized professional services when it comes to network configurations. We also have our technology solutions group, and we're also a Cisco Gold partner. So when you look at that, network, iOS, and the software that goes along with it all have to work in conjunction to deliver a solution like Nav Track. Then when you're looking at deploying it itself, we have a technical information and distribution center based in Wilmington, Ohio, that can help you when it comes to delivering the devices at scale. We can bring in all of the iOS devices, asset tag them, engrave them, kit them with the appropriate accessories, and onboard and offboard, right? We can reduce packaging. We have direct access into Apple's Business Manager to load the devices for you through the DEP program that Apple offers to deploy serial numbers at scale. And we are authorized in a break-fix capacity for Apple inside of warranty and outside. So leveraging Apple Care or Apple Care for Enterprise is easy and fluid. Our technical certifications, we are authorized at the highest level with Apple. We have Apple certified support professionals. We also support Apple Provisioning Utility. We were the first company to be certified in Apple Provisioning Utility, which helps with an automated deployment method. We're also a Jamf Gold reseller, integrator, and managed service provider, but we work with all of the mobile device management software providers in the marketplace today. Next slide. So when you look at bringing it together, there is many things that go into deploying an iOS solution in healthcare. Number one, you have to have somebody who's authorized to sell iPhone. Connection is authorized to bring iPhones into the healthcare space. We're authorized with Nav Track. We're a Cisco partner and we're a Jamf partner. Again, any MDM service can work in this space. But when you bring it together on a single statement of work, that makes it a very seamless and fluid way to deploy Apple. It makes it easy when you can procure the iPhone, the software, and even the charging stations, peripherals, or let's say in this case, you would need iBeacons or Bluetooth low energy beacons to help with the Nav system. We can procure and source all of those products for you, put them together in a singleized package, and create a single statement of work. It really makes it simple and easy to deploy this in a fast manner. You heard Brie mention earlier that it's simplistic. Well, simplistic doesn't mean simple. And deploying Apple at scale requires expertise. And Connection can help you deliver that in a very fluid manner, but also concise. Procuring Bluetooth low energy, procuring the iPhones, procuring Nav systems, and delivering it with our technical solutions and mobility practice can really help you deliver at scale in a simple and secure manner. Jerry, back to you.
All right, thank you, Paul. We're now at the question and answer part of this here. And so we have a couple of questions, but I'm sure we have a lot more that people just haven't entered into the Q&A. So click on your toolbar there, go to the Q&A and send your questions in. So our first question is, what criteria does Nav consider when selecting medical equipment to track? Do you want to take that one?
Do that. I think there are a number of criteria points, but really it's understanding first and foremost what's mobile. Of course, this is a tracking technology, so we really want to understand which of our assets are most mobile in the hospital setting. There's that component. There's a component of understanding the problem identification. So specifically, what mobile assets are the frontline having a hard time with? Is it wheelchairs? Is it IV pumps? Is it a monitor? Is it something else? So it's understanding what exactly what are the pain points that the front line is facing? Where is it going to add value? The last component I think that's important to consider is, of course, the cost. These technologies are not inexpensive, so understanding where there can be the greatest impact, not only as it relates to operations, but also to cost in the long run and getting that ROI by looking at perhaps some of your more expensive equipment is also a great place to start in determining what types of technology should we be tracking at any given time.
Okay. The next question, why did Navs start with patient transport?
Yeah, it's a good question. Patient transport is interesting for a number of reasons. It's simply because you have the workers involved, or transporters, but you also have the patient directly involved. And there are a number of moving components with this and a number of potential outcomes. I think really what Nav was smart about was that they wanted to do something that directly impacted the patient experience right from the get-go. So really using this technology to see an outcome that leaves patients happier, that ensures that they get to their appointments. It was really encompassing a lot of moving components. And it also, of course, helped the employees by allowing them to communicate and map out where they were going within the hospital. It also covers a wide range of the hospital. Transport does. People need to get across the entire hospital within minutes. Henry Ford Hospital is very spread out, so transport was a nice way to map out the entire hospital.
Our next question, yesterday, Governor Whitmer announced a application tracking program for residents of the state of Michigan for COVID tracking. So I think the concept is that you download the app, as you interact with other people throughout the state, and then if you come down with COVID, you send your that I've got COVID, and then you get notified by people who you may come in contact with. How is something like that similar or different than Nav Track?
It's interesting because it's one of the themes I think throughout NAV systems is the ability to reuse their technology. And I think COVID is another great case study for this technology. And as it relates to contact detection and contact tracing is what you're getting at, there's definitely a use case within NAV systems pre-existing platform. We can identify where people are down to within a couple of feet accuracy, and it's constantly updated. So it creates an opportunity to understand how close are people staying next to each other, how long are they standing next to each other, allowing them to measure not only proximity, but exposure and length of exposure. And then there's also the communication platform. So going to your last point of being notified that, hey, you've been exposed and are potentially at risk of getting COVID, that messaging platform could be applied for the same use case. So it's something I think that it's on the roadmap to explore. The pre-existing technology already exists. It's just a matter of applying it and validating it in that new use case.
Okay, thank you. This user here says, hopefully it's not too nerdy to ask. Perhaps I missed it. What technologies are at play to track a given asset? So I think the question is, what are all the technologies that make this work besides just the iPhone?
Paul, do you want me to take your
Go ahead. Go ahead.
From a NAV perspective, there is the Nav Track software solution that was created in partnership with Apple using those pre-existing mapping technologies. There's also the iPhone where the app can be downloaded, and that phone serves as a mobile sensor, almost like a mobile beacon. The last component are additional Bluetooth-enabled beacons throughout that can be attached to a badge or attached to a medical equipment. And all of this is conducted over the pre-existing Wi-Fi infrastructure that a hospital has, for example.
Yeah, I think just to add on to that, typically when you're deploying iOS devices, you're also going to be using a mobile device management system. So that's another piece of software to deploy Apple. On top of that, she mentioned iBeacon. iBeacon and Bluetooth low energy beacons can play into this type of solution, as well as the Apple mapping she mentioned earlier and the Nav Track system itself that brings it all together. It's a really interesting piece of technology and really well done.
Okay. The next question is regarding contact tracing. How does Nav address patient and guest tracking?
Yeah, this is something that we're still exploring at an early stage as it relates to patients. This is done currently on employee phones. This is not being used on my phone, for instance, if I was a patient. So it would likely require a slightly more manual process. Of course, we'd have to take into consideration the privacy and security implications of tracking our patients. That being said, if they're with a transporter, we can understand which transporter they're with at any given time, or what environmental services worker was in their room, or who dropped off their pharmaceuticals. Those are all considerations that we can look at as it relates to contact detection and tracing.
Okay. In one of your first slides, you had a number there. I believe it was relative to cost savings. Has Henry Ford generated any estimate of what kind of cost savings they've achieved from this benefit so far?
Yeah, we're looking at a few different use cases. Right now, the initial impact has really been focused on looking at how it impacts the patient experience and how it's improved workflow overall. As it relates to cost savings, we'll be looking most closely at time in the future and the cost of equipment. So, for example, are we over purchasing equipment? And as a result, can we purchase less equipment and save money that way? These are the types of case studies that we're currently analyzing to understand what exactly that cost savings is.
Okay. Here's another question. Do you see applications for this technology in regional, statewide, and/or national tracking and distribution projects? For example, during the pandemic, vaccine distribution, PPE, meds, staffing, tracking across a state or a region, or even patient identification and tracking?
Yes, of course. We're looking at this for a number of use cases. The technology at the end of the day, I've spoken about this from a healthcare perspective, but really indoor location tracking in real time, that can be used in manufacturing, in logistics. We're already kind of experimenting it with our supply chain, of course, in the healthcare setting. But one of the tools that Nav has built out is looking at making sure that supplies arrive to the right location at the right time in the hospital setting. So there's no reason this couldn't be used in the format of vaccine distribution, for example, or PPE distribution.
Yeah, and Jerry, I'll just chime in there briefly. We are talking to several customers, or in discussion phases with several customers in relation to just that. How do they track their PPE? How do they track their pumps? And believe it or not, how do they track their wheelchairs? Because, for example, a return on investment would simply be if I can reduce loss or reduce time to endpoint, there's a substantial cost savings. The analysis has not been completed as yet, but there are a number of customers looking at that just based on a cost savings method.
Okay, I think we are at our last question, unless anybody wants to lob one in real quick. I'm going to start to wrap us up here then. So again, on behalf of Michigan HIMSS, I want to thank both Brie and Paul for their expertise that they brought to the webinar. Hopefully you found it very informative. We appreciate you engaging with Michigan HIMSS. As I said, we're going to be doing a lot more of these webinars of this type in the future. So if you have an idea of a webinar, bring it to us. Get engaged with us, check our website, check our events calendar for future ones that are coming up. Again, I want to thank our sponsors, because the sponsors are really the lifeblood that keeps the chapter going. So you see our sponsor slide there. We will send a PDF version of this presentation to everybody who is on the presentation today. And I had another thought. Oh, we've also recorded the webinar. So if there's somebody in your organization who you think could benefit from seeing the webinar, we'll provide you the recording link as well. So once again, Brie and Paul, thank you very much for your presentation today, and thanks everybody for joining.
Thank you.
Thank you.
Okay.